My message to people when they're being diagnosed is not to make any drastic changes in their life. Keep living, keep doing the things that you've always do. Do more, in fact. We'd very much encourage people to do more and engage in everything that's around in the community. And that, very much includes things like the arts.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox and today we're speaking about dementia and arts and health as an engaging and supportive way of working with people with dementia and related issues. More than 500,000 people in Ireland have been affected by dementia. The Dementia Understand Together campaign is working to raise awareness of dementia and create an Ireland that includes and embraces people with dementia and their loved ones. So our guests today are going to give us some insight into their work in the area of dementia. Our guests today are Rosin Nevin, who is the Creative Life Coordinator at Mercer's Institute for Successful Ageing at St James's Hospital, Matthew Gibb, who is the Director of Dementia Services in the Information and Development Centre in St James's, and Catherine Daly, who's the Senior Occupational Therapist in the Memory Harbour in Clonskea. You're all very welcome to the podcast.
Many thanks.
Thanks, Fergal.
So, dementia, arts and health. Matthew, can I start with you and let's clarify what we're talking about here in terms of dementia, make sure that everybody's on the same page. Can you give us some insight into your work with people with dementia?
Okay, well, as you said, I'm the Director of the Dementia Services Information and Development Centre. Bit of a mouthful. We call it DSIDC for short. But we're engaged in education, training, information provision and research. That would be our bread and butter. Now, the information, training and research is mainly based around health and social care professionals. The information that's good for use by the public, but it's also directed at people working in the memory assessment and support services that are rapidly growing around the country as we speak. That's born out of my own clinical experience working in memory assessment services.
Okay, and Roisin, what's your experience in this area?
Well, I suppose I bring today some experience around arts and health intersections, and it's very much related, but not specific to dementia. So I work in Creative Life Pillar in the Mercer's Institute for Successful Ageing in James's. And that role started back in 2017. And so the arts and health world and that kind of policy side of things, it's really emerged over the last 10 years or so. We work at the intersection of our hospital and our community. When we work with our artists and residents and our musicians and residents, they would work with people living with dementia and their carers and family members.
And Catherine, you're deep in this work as well.
Deep in this work, yeah. And deep in this work for a long time, I suppose, since I graduated many moons ago. I always focused on people who are experiencing dementia or memory impairment. So I'm a primary care occupational therapist and I'm based in the Memory Harbour in Clonskea. And the Memory Harbour is one of 24 national memory technology resource rooms. So on the Understand Together campaign on their website, for any of your listeners, they can find their local memory technology resource room there. And as occupational therapists in the memory technology resource room, essentially what we're looking at doing is meeting people when they've either received a diagnosis of dementia, so maybe they've gone through a process like Matthew would have spoken about, or perhaps they have a diagnosis of mild cognitive impairment or some subjective memory impairments. So we were meeting them where they're at. I suppose they're walking through our doors. The shoulders are usually up. They've usually been reading up on what day it is on the way in the car. That's kind of stress around memory and how their memory is affecting their lives. And essentially, we're trying to meet them at that space, create a bit of hope in their lives for them, talk to them about the kind of things that they have to do every day and the kind of things that they want to do every day and how they're noticing that the changes in their memory might be affecting that.
Yeah.
And then we're really looking at bundling that person, and bundling that up together in terms of saying, okay, how can we help support that person to live the best life that they can, even with the memory challenges that they're living with.
So this is a really sensitive time for the whole family. I'm thinking about the families and carers listening to this episode. And Matthew, coming back to those assessments that you mentioned earlier on, just listening to Catherine there talk about trying to be supportive. What's your experience of those memory assessments when you're coming in or you're supporting people at that sensitive time?
Yeah, very, very stressful. Changed a lot over the last 20 years, though. Since I've been working here in this field, it's developed and improved dramatically. Our ability to diagnose has improved dramatically, but I think also the way that we engage with people during, as you say, hugely stressful times has improved quite dramatically as well. One of the things for me anyways, as a social worker, is my background. And I think Catherine really hit the key word there, which is when we're communicating diagnoses of dementia these days, we try also to instill a feeling of hope in people as well. Maybe when I first started here about 20 years ago, there's a lot of kind of nihilism, there's a lot of despair around the diagnosis of dementia. I think that's certainly changed these days, and it's being viewed much, much more as a chronic illness. Because we're diagnosing people at much, much earlier stages now. We're talking about management. We're talking about how people live with these conditions over a long period of time. It's not a case where people are being diagnosed and suddenly their life as they know it is ended. That's just not true. We do try and instill this whole feeling of hope into the whole process. I mean, certainly my message to people when they're being diagnosed is not to make any drastic changes in their life. Keep living, keep doing the things that you've always do. Do more, in fact. We'd very much encourage people to do more and engage in everything that's around in the community. And that, very much includes things like the arts, everyday activities as well. We don't want people to change. We want people to engage as much as possible.
So with that frontline assessment point of view, your sensitive communication to the carers and the families is crucial. That's what they're going to take away. That's what they're going to socialise with their other family members. Matthew told us this.
Yeah, it's very much focused at the person. The family members are there and are there to support. It's really focused at the individual who's been given the diagnosis. I think to look at it any other way would be very paternalistic, but it's very much focused on the individual. And we concentrate very much on remaining ability, not on disability. We're trying to maximize everything that they've got going for them. And certainly for most people, we're diagnosing them, in the main, we're diagnosing them at a much, much earlier stage than we were 10, 15, 20 years ago. We can give them the skills, we can give them the supports to help them maintain their quality of life as best we can. So we really are trying to give people the best possible opportunities to manage their own conditions as best they can.
Okay, so maybe I've been unrealistic about the management of the condition would need support straight away.
Absolutely, and people don't often need support straight away. Now, it depends what age cohort we're talking about and also the subtype of dementia that we're talking about. The vast majority of cases of dementia are Alzheimer's disease, which tends to be very slow and it kind of meanders along a wee bit as a condition. So if we're diagnosing people in a very early stage...
What do you see as early now?
The tipping point for a diagnosis of dementia is when people have got problems with their thinking and or their memory, but to the extent where it's actually interfering with everyday life. Okay, that's the tipping point. At that juncture, that's usually when people are coming into the clinics. It starts to interfere in things that they're trying to do on a daily basis. What we would do at that point, the memory might be a bit poor or, maybe have some problems with some of their thinking skills, but on the whole, they're functioning very, very well. So all we're doing is we're telling them what's going on. We're giving them the diagnosis. We're also trying to get them to think ahead about how to plan for the future, how they can build in the support networks that they need so that they continue living a good quality of life.
Dementia looks very different now. I think, both Matthew and I have been around a while in this area. And when I think about a client who came in to me recently who had a diagnosis of dementia and, so I'm kind of going through, how are you and how are things? And she said, I was at the Coldplay concert last night. That's what dementia looks like now. Do you know what I mean? People living really big, full lives. Okay, it's a condition that is going to change over time and people will need more support over time. But because people are being more proactive around their brain health now, people may be getting diagnosis of mild cognitive impairment, or that's, as Matthew's saying, when the balance tips, now we have a diagnosis of dementia. But we're early in that process. And so that's where we're looking at, okay, yeah, keep going to the Coldplay concert. And you know what? Here's a group that you can go to. And maybe here's a dance class that you can go to. And perhaps there's a local writing club that you can get involved in, because all of those things are going to be really good for your brain health. We know social connectedness is so important. It's a big protective risk factor for dementia. So if you've been diagnosed with a memory concern or with mild cognitive impairment, the real key message is exactly what Matthew was saying and Rosin would say, get out, do more, see what's in your local community. I had 9 people in a group with me this morning, all learning about their memory, like magic, and all of them sitting, talking to each other and saying, yeah, I do have some word finding difficulties. And what we were hearing this morning in the group in terms of people's lived experience and what I see a lot in the memory harbour is somebody saying, I'm going to give up the bridge now, or I'm not going to keep going to my choir because I missed somebody's name last week and I should have known their name, or I couldn't find the word for something. And so that sense of anxiety and natural stress that comes with it, often what happens then for people is they start to retreat. And a lot of our work is to move back into the world, because actually once you retreat, then your brain health is going to take an even bigger knock, because we know loneliness, social isolation is a really big risk factor for your memory getting worse. We would have seen that during COVID even. We're still seeing people coming in having been isolated for a period of time. So if you're listening to this podcast and you do have, some issues with your memory, keep going. Maybe find a friend who will come with you to a group or a club so that it makes it a little bit easier for you. But don't stop.
Yeah.
Because we need you using your brain, and we need that because that's going to maintain your brain health and keep your memory as good as possible for as long as possible.
Yeah, there's lots of great messages here for everybody in terms of brain health. It's very interesting that you say there that there's an added risk of pulling away from the vital supports that are going to keep you engaged. And Matthew, you mentioned the supports in the community and the supports, the work that you're doing, Roisin, you're trying to provide some opportunities for that.
Yeah, that's one dimension to creative life. It's providing that education as well as opportunity and access for people to participate in both art making and music making. There needs to be a differentiation between arts and health, music and health versus creative therapies and music therapies. And sometimes people don't know that, but this arts and health world is emerging, and it's just to understand on both on a national level and within our health systems. There's lots of change with arts access in various different locations, both in communities and hospitals and through the local authorities. So for people out there that want to access arts program or cultural programs, sometimes that can be within a hospital. Sometimes it's in the local gallery or the local museum. It just depends. And it's really active at the moment, this development. And we're all interconnected. This is how we all connected through the Crucial Views seminar that happened a few weeks ago, where we brought in the likes of Sarah McCormick, the Healthy Ireland HSE lead. And she's really instrumental in bringing this change around arts and health into our health systems. So then when you say for a programme like ourselves in Creative Life and MISA, we need that funding, that structures to develop. And then when we have that in place, we can reach out to our social prescribers and they can connect in with people in the community, and you can see the benefits of them participating. So you don't necessarily have to be arty. Sometimes people think, oh, I have to be arty. We've forgotten that creativity is an integral part about being human. And when we remember that and when we are exposed to that, it brings out moments of joy and self-expression that can be witnessed, not just with the person living with dementia, their carers, the healthcare workers that are looking after them. So it's very transformative in that respect.
So let's talk about that, because I think that is central to this, us increasing and normalising arts and creativity as a medium. It's great to see it increasingly becoming accessible in healthcare settings. I absolutely agree with you, Roisin. We need to get over ourselves a bit around, I'm not arty. But it's interesting that you put it like that. And I was telling you last week when we were talking about this podcast that I've seen it, in my experience with dementia is limited to my father-in-law, who I've become a little part of the support system around there. I see that, that's why I think somebody in their early 80s, listening to you guys, there's just a myriad of experiences here. But I've seen him latch on to music a bit, and it seemed like even singing beside him and him finishing lines of songs, it just becomes so engaged, where you're struggling to engage him on the day-to-day, and you're introducing them to your kids on a daily basis and things like that. It's tough, but to see him able to latch on, and I'm thinking, it's about latch on. Like, you just need to create opportunities to latch on to
bring out that side of creativity, because sometimes around dementia, it's spoken about sometimes in the biomedical world of the loss, whereas creativity can reach those places of the brain that hasn't been affected. And that's where you can see from choirs the joy of just singing and being part of a group, or those in-the-moment experiences. And for their carers to witness that, and they're co-creating on a project as opposed to being told what to do.
Yeah.
They're actually being creative themselves. So it's very powerful to witness. And I know it's only going to improve our interconnections with the world and the various groups, whether it's the DSIDC or the work that Catherine does, or Understand Together. It's just about joining the dots, really.
Joining the dots. I'm sure you've seen that, Matthew, as well. We're trying to offer a supportive pathway for people, isn't it?
Mm-hmm. When people are being diagnosed, we're looking for everything that people can engage in. The first protocol isn't necessarily the public health nurse, for example. It will be the local art gallery. It will be the GAA. It will be something very much in the mainstream. From my own point of view, any organisation pretty much that's profiting from the public purse has an obligation to step up and support people with dementia. That's across the board. I don't see why anybody should be excluded from that particular role, if you like. These are our parents. These are our brothers, our sisters, our uncles, our aunts.
Yeah.
They have every right to live in a full role in our world as we do. Just because they're having problems with memory or thinking is a secondary thing as far as I'm concerned. It's us that are disabling them, not the other way around. I mean, we need to be making sure that our society is as inclusive as possible to allow these people to live, not the other way around.
Yeah, I never saw it like that. We're disabling them, yeah. So we're just not tuned in enough.
Well, if you think about it, it's the same thing. A person in a wheelchair, if you put them in front of a flight of stairs, they're going nowhere. But if you put them with a ramped access, they're getting somewhere. It's the same thing for people with dementia. You just got to make those changes in society to make sure that they're included.
And I just want to recognise the Dementia Understand Together campaign, while led by the HSE, is working in partnership with the Alzheimer's Society of Ireland, Age Friendly Ireland, Dementia Services Information Development Centre, Age and Opportunity and Healthy Ireland. And there's 60 national partners across retail, transport, banking, health, arts, voluntary, community. That's, I suppose, the coalition of the willing that you're referencing, Matthew, that we have a moral imperative to act.
I think also taking the intergenerational approach is good, that it's not nearly siloed, that it's actually intergenerational, it's cross departments, it's multidisciplinary. It's all of those approaches. I think it's beneficial for the person living with dementia, and also engaging with the younger generation around just what Catherine was saying around brain health, building up your cognitive reserve and getting involved, whether it's physical activity or creativity and arts. I think it's also to engage people at a younger age.
Yeah, I keep kind of thinking about that the brain health, even the recommendations that you're saying, when somebody's getting a diagnosis, they're good health recommendations anyway, but you're saying like there's an increased risk now. I can see there's a change here. These are very important for you now. Is that what you're saying? Yeah,
really crucial to stay connected to your community, to your local clubs, to your friends, to your family, and to try new things. We don't have to be saying that to people. And that's where, when we talk about creativity and that sense that some people, and especially maybe some of the generation that we're working with that may never have been encouraged to try anything that would have been considered frivolous, like art or music, or to try something that is more creative. And what we see when that happens, and I suppose my experience of it is when we do creative, and creative arts can be all kinds of things. It can be art, it can be music, it can be choir, it can be dance. We're engaging the brain, but we're also mostly, I think, moving from a very factual world into a world of feeling. And for people with dementia, that's kind of where we want to be. That's the lovely sweet spot. That's what you're seeing with your father. That's his procedural, it's his long-term emotional memory that's remembering those songs. That's where he feels competent and capable, because I can do this. I can know this music. I can sing along. So that's a lovely feeling for somebody to have. And creativity does that for people. So most of our world, and if you have a dementia, if you have a mild cognitive impairment, a memory impairment, what's tripping you up mostly is your short-term memory. So names are the word finding, as I was mentioning earlier. So maybe finding the word for something. So I'm in conversation and now I'm stopped because I just can't think of that word. And now I'm aware I can't think of that word. And now my anxiety builds and then my brain absolutely will not find that word, no more than any of us do when we're under pressure. That short-term memory piece, the factual world, aren't we meeting at 10 o'clock on a Tuesday? That kind of piece can be the piece that can be challenging for people with memory impairment and dementia. But if we move into the feeling world, if we start to read a piece of poetry and we just talk about our opinion on it, then nobody can be wrong because it's all subjective. And so now we're moving into a place where I can have confidence. I can listen to a piece of music. I can remember a piece of music from years ago and all those words will come back to me and I will feel in my body competent. And that's a lovely feeling because for people with memory challenges, a lot of the time the messages that they're getting is that they're getting frustrated or they're not doing things right. That's a hard way to live. So it's to try and redress that balance, isn't it, through creativity?
And do you find it challenging to introduce creativity? Do you see the normalisation of that as a medium increasing?
It can be. So I know we're going to talk a little bit about the poetry program that I did last year, but it's very interesting for a number of the people who came to see me, who I invited to the poetry group. They came because they trusted me, which is lovely for me, but they had a relationship with me. And I think that's why, across the board, whoever your health professional is that you've got a key relationship with, if it's your public health nurse, if it's your social worker, if it's somebody in the community, somebody from the men's shed, when you trust one person, they can kind of nearly get you into a room. And so most of the people who came to the poetry group that I facilitated had never written poems before. If I had asked them to go to a local poetry group in the community, I don't know that they would have got past the door. And actually, some of the evaluation afterwards was kind of, well, look, you said it was good for me, so I kind of went along. But actually, I wasn't necessarily that into it. But then after the first week, they all wrote a poem and they went home and they went, I wrote a poem. And half of their family members went, you didn't write that poem. And they said, I did write that poem. And so then what we start to do, I suppose, is shift people's thinking around creativity. So now they're like, well, I didn't think I could write a poem and I can write a poem. So like, what else could I do?
Mind-blowing stuff.
Maybe I could dance. Maybe I could play music.
Yeah.
Who knows? But I think you're right. Sometimes there is that barrier into creativity. And that's where I know we've got a great relationship with the DLR Arts Office because that's my particular catchment area. But doing anything in collaboration, I think, is really key. That's what I'm learning. Partnerships, collaboration, who's around, who's doing what. So the whole poetry program came because of a phone call that I made to Moira in the Arts Office. And Moira said, okay, I'll get you a poet. And I said, okay, I'll get the people and I'll support it and let's do it together.
Yeah.
But you've got creative communities, Creative Ireland, you've got men's sheds, you've got lots of the dementia advisors around. So there's a lot of people there in the community, good people doing great things. If somebody comes and they trust me and then I say to them, look, there's a terrific programme that's on in St. James's Hospital, will you try it?
Yeah.
Maybe I'll meet you at the first one and then maybe that might be all it will take to get somebody past that threshold. But it does need
a supported referral, if you like it.
Yeah, and I kind of call it a bit of a transfer of trust.
Okay.
If they trust me and if I trust this person, then maybe we can transfer that trust from me to that person.
Yeah. Roisin, I'm sure you've seen this on a number of occasions yourself.
Yeah, well, it's great to hear what Catherine is doing out in the community. It's really a fantastic example. Like when you're looking at arts and health, that's the ideal person to have there, like Catherine. What we're doing is nearly bringing two worlds together. We're bringing the arts world together and we're bringing the health world together. And we're working within this intersection and we're trying to figure out shared goals. And you talk about the challenges and that this is a new way of working as such. It's not fully understood. And so the next phases of this integration side of things is around education and training. And so we have been at Creative Life instrumental in co-designing the first professional diploma in arts and health with NCAD. And so it's a level 9 diploma out there for people to understand this world. And so part of that section, I would have Matthew give a lecture around that dementia specific, or if there's a project some of the artists want to work with. So in that course, you have people from an arts background. Also, you have people from a health background. You've got psychologists, you've OTs, you have physios, you've various different people. So it's people that understand and appreciate that arts and creativity can make a difference in people's life. So it's looking at the whole person, not just their condition. And it's really focusing on that person-centered care. And when you're looking at saying if there's challenges, I can look back in 2017 and look at things today in James's, and they're so much different. In the early days, people did not really know what you were talking about around arts and health. Now we can refer to the WHO 2019 Synthesis Report. We can talk about the Creative Health Report in the UK. We can look at the work in Finland, and they are very much integrated arts within their health system because they want to bring meaning within their health service.
It's a win-win, isn't it? Like it's
It
just, I know,
is.
like it seems obvious now when you're given those really tangible examples.
Yeah.
Like you said, they're creating meaning.
Yeah, it's about creating meaning. And, in Ireland, we're catching up. Since 2020, it's really actively happening. And this is a generational change. So I really believe there will be significant differences within the arts and social care over the next number of years, because we have to remember also the next generations are growing up. And you've got millennials, you've got your Gen Z, and they value creativity. And they will be expecting, where's arts and creativity? So it's about normalising that. There's lots of positive things happening at the moment out there. And it's great to have an opportunity like this on this podcast to talk about what's happening out there,
We hosted a conference in conjunction with Creative Ireland and other partners last year for travellers as part of a traveller wellbeing through creativity, where we facilitated travellers and supported travellers to engage in creativity, and they showcased their work. And It was inspirational to see that they were able to showcase both elements of their culture, elements of their experience of racism and discrimination, as well as their health and so many other issues, but able to kind of explore them, engage them, and showcase their insights using creativity and arts. I'm not joking about it being mind-blowing. Like, more than that, when you see somebody latching on to a song, somebody just losing themselves in creativity and producing a piece that helps you see how other people feel.
Yes.
It's getting very, very near that meaning-making, like you said there.
Yeah.
Sweet spot.
Yeah. So there's lots of people within the arts and health world. You've got Realta, you've got Arts and Health Coordinators Ireland, you've got Creative Ireland. They're really driving a lot of change through the local authorities with the Creative Ireland engagement officers and the Healthy Ireland officers. So there's huge potential for future health system to incorporate arts and creativity to improve patients' experiences and also staff's experiences too. That sense of belonging. We had International Nurses Day a few weeks ago, and there are 51 different countries that represent nursing department. And Sharon Slattery is the Director of Nursing. We had a Cayley caller that came up from County Clare. We had taster sessions and we had everybody from all cultures involved learning how to Cayley dance. It's bringing that sense of belonging. And many other years we've had Bollywood dancing from the Philippines. But what that brings is an understanding from healthcare workers, the meaning of creativity. Once they have experienced themselves, they can be the best advocates and ambassadors of creativity. And exactly what Catherine is doing on her day-to-day job. It's all good.
There's a few different types of dementia. Matthew, can you give us some insight into that? I had a conversation with the former school friend there last year, and we were talking about parents, and we met up with some other old school friends, and the conversation was about parents and the different types of experiences of dementia. Was it a conversation topic? I've heard of Lewy body dementia, and we featured that on a previous podcast, but I wasn't familiar with some of the other types. Can you give us some insight into some of the variations?
Sure, yeah. I mean, my world, subtyping of dementia is really important, and it very much has a bearing on the kind of supports and help people might need. But 60 to 70% of all dementias would fall under the Alzheimer type category. After that, we're looking at things like vascular dementia. When I was first started off, vascular dementia used to be quite common, but it's become less so now. And I think that's probably as a result of improved diagnostic skills. It tends to be a mixed dementia. It tends to be vascular dementia plus a bit of Alzheimer's disease. Then we're seeing things like Lewy body dementia, as you said, which is it's on the kind of Parkinsonian spectrum of conditions. Frontotemporal dementia, those would be the main ones. Parkinson's disease dementia, again, which is slightly different from Lewy body, but those would be the main ones that we'd see in and around the country now. After that, you're getting into pretty rare territory, to be honest. You're talking, maybe a handful of people in the whole country, maybe with certain conditions that would perhaps fall under, what we call progressive supranuclear palsy or cortical basal degeneration. Those ones, they're pretty rare conditions now. We do see them occasionally in specialist centres like St. James's, but the vast majority would be Alzheimer's disease that people will see.
And the support system is increasing. From personal experience, you can see that there's people around the country wanting to help you and your family. I can't see that support system, but just from a personal point of view, I can know that there's people there trying to engage families as well as, the people themselves and give them support.
Yeah. One of the things we've got coming up this Friday, we've got a massive conference coming up. It's all the memory assessment services in Ireland coming together to meet down in Trinity. This is the 10th amalgamation, almost like a calling of the clans, if you like, of people working in memory assessment services. And we started that, I think, in 2011. We pulled the first conference together, and this is the 10th iteration of it now. But it's a big deal. The memory assessment services over the last 4 to 5 years have probably more than doubled in size in actual number of personnel working, and in sites around the country. There's a dementia model of care which very much lays out what these services should look like so that we're not getting a postcode lottery of what happens in different parts of the country. The Minister for Older Persons is going to be there on Friday as well, and numerous individuals from the HSE involved in all aspects of service. So it's a big deal. It's a big deal. There's a lot of people gathering all under the same umbrella, and all looking to do the same things, which is try and improve diagnostic and post-diagnostic supports for people with dementia as the numbers increase.
Great. And your role in terms of that training remit that you mentioned at the outset for healthcare professionals, obviously then that networking conference event is huge value for money from your point of view. But how do you offer training to healthcare professionals on a day-to-day basis? How do you manage to do that?
Well, that's become much, much trickier these days, because people are very time poor.
Yes.
Certainly the people we're dealing with on a regular basis, certainly in hospitals and nursing homes, it's very, very hard. I mean, the HSE is they're currently going through a revamp of their educational offerings in the world of dementia, because back in the day it used to be quite common to get people released for a day, maybe 2 days to do training. You're lucky if you get people released for 2 hours these days. So our training we would offer on more and more we're offering that on a bespoke level. So people are coming to us and asking us very specifically what type and what the duration of training. We're also on our website, Dementia.ie. We've got e-learning packages on there, and they vary from roughly 20 minutes to half an hour, right down to what we call micro-learning, which are very, very short, very focused pieces that will take somewhere between 7 or 8 minutes to complete. But looking at, as I said, a very, very focused and narrow topic and delivered very quickly.
So you're trying to build the capacity of people working in the health service to be able to support and respond to people across the health service. They could be engaging with people with dementia on a day-to-day basis.
Yeah, I mean, some of it, as I said, if we're looking at very specific modules like the micro-learning ones, we might be just looking at one very small topic like communicating with a person with dementia. It's just giving some very, very quick and clear suggestions or ideas or strategies that people can adopt. And, they don't necessarily have to be experts in dementia care. I mean, a lot of it is just getting people to, even just saying simple things like talk to people with dementia, just like you would do to anybody else.
Yeah.
They're ordinary people. After all, we don't have to speak up, speak down, or anything else. We maybe have to change maybe the depth or the level of the conversation, but we're still speaking to them as normal individuals.
And so some of that training is accessible on Dementia.ie?
Absolutely. Certainly all the electronic versions are there available. It's all free of charge. There's no cost for that.
No, I think there'll be a lot of healthcare professionals interested, and they'll have a bit of knowledge, and they may be interested in getting a bit more.
Yeah. As I said, they don't need to be experts. We're just looking to improve very specific areas of practice. One of the recent courses we did was on person-centered care. The reason why we did that was because I felt it was becoming an overused, hackneyed phrase that everybody said, I'm person-centered. If you look at every single nursing home website, it will say, we practice person-centered care. It became almost meaningless as a phrase. So we stripped it right back down to its basics and got people to, hopefully people look at that in a slightly different way now, and perhaps put a bit more meaning back into the phrase, And it is just about putting the person front and center of the whole process,
Very good.
What I would just add to what Matthew's saying is not to forget about the non-pharmacological ways of managing some of the symptoms of dementia. I think that's an important part for where arts and creativity can play an important role in the future.
I'd also add in terms of just connections, I'm thinking back to when I was redeployed during the pandemic. I was landed into a nursing home and kitted out top to toe and went in to try and meet somebody there who had a different point in dementia, obviously, because they were in a nursing home at that point. And lots of, I suppose, information around their falls risk and all that kind of physical stuff around. And I was kind of going, but where's their life story book? Where did they go to school? What was their favourite song? Where's the actual real meaningful connection that I can make with this person so that their day and my day will be better? We need all that other information. It's all really important, whether it be at a nursing home stage or whether it be at an earlier stage. But really what you want to find, in occupational therapy terms, we call this someone's occupational identity. It's like what makes them tick.
Yeah.
That's what you want to know. If you can get that, and I often say to people, it's never too early to start life story work in terms of really starting to think through what are the things that are really important. There's fantastic templates out there. There's free templates online. There's lots of different books that you can use. Having that connection, because what you want, I suppose, if somebody's memory does start to change, if someone's communication starts to change, you want a shortcut straight through to the things that are of meaning to them so that we can trigger that emotional memory. We can get the song that they love so that they can sing it.
So powerful.
We can talk about a piece of music. We can talk about a piece of art. We can talk about where they went to school. That kind of stuff that's going to just bypass all of the, as I was saying earlier, that kind of factual word, the short-term memory, all the bits that we all have to keep on top of every day and get to the stuff of meaning. Straight to the meaning, straight to connection.
Yeah, that sounds beautiful.
Catherine, when you're mentioning that around programmes within the Irish Museum of Modern Art in Emma, they have an Azure programme. And that Azure training actually exists in many different galleries throughout Ireland for carers or people living with dementia to make note if that training is in their locality. Within IMA, they have a Horizons programme. And so the staff are trained to take people on an experience of slow-looking art Again, you don't have to have any kind of experience in art or the arts. And it's just a very kind of slow looking methodology that can be shared both for all the family. And it's to reach out to Barbara Ann Harkin or Sandara O'Higgins in Emma, and they can help people facilitate a visit to the museum.
That's great. Thanks for that, Roisin.
Just to add to that, because I know we're doing a brain health gallery tour with the DLR Arts Office and the Lexicon in Dunleary. So again, if Emma isn't on your doorstep, check with your local county council, your local arts office. Oftentimes, like in the Lexicon, there might be an art exhibition on. And so they'll facilitate an artist to do a slow gallery tour, essentially that same model, but just happening in your local library. So just check again like that, just reaching out to that local county council, your local primary care centre, what's available locally for me and for my family. What's dementia inclusive? What's dementia specific? What creative processes and creative arts are out there that we can just, dip our nose into and see do we like?
Yeah, no, great call. Can we go back to your poetry example? Because you said you would share a piece of poetry from your work, and you were talking about a poetry workshop.
Yeah, so I suppose last summer, as part of my general work, I would run cognitive rehabilitation groups. So that's the group that I was running this morning, where I have a number of people from the community coming in. We work on our brain health, we learn about memory, and we do a lot of education and we do a lot of practice. And it's a really good, supportive group. And I suppose this is probably where a bit of my personal life and working life intersect, because I'm a writer myself. I had the opportunity once to stand up and read something that I wrote to an audience, and it was an incredible experience personally for me. I started thinking about that, creativity, and as occupational therapists, that's something we're really, really interested in. And sometimes like that, we all end up in more medical settings and we can lose that. But I started thinking about, okay, well, if I did a cognitive rehab group, essentially, I'm still going to be working on brain health. But what about if I focus on poetry instead of learning about memory every week? Because actually, still everyone is going to have to learn people's names, come to the group, schedule it in their diary. So if I'm coming to a group at 11 o'clock, my planning and executive functioning is starting, because I might have to get up earlier. How am I getting there? Am I driving? Am I getting the train? Am I getting the bus? So we're challenging brain health anyway.
Yeah.
But then when we got people into the room...
You're integrating it completely without...
Exactly. But then we're not making memory the focus when they're in the room. We're making poetry or writing or arts or dance, whatever it is, the focus. So the poetry, we published a booklet called Yellow Days, and we called ourselves the Harbour Poets because we wrote it beside Dunleary Harbour. I suppose, again, that's a collaboration. It was the Arts Office. There was a lady who had come into me who used to write poetry all her life and kept putting them in the drawers, never read them to anybody, was very shy about her poetry. And I went looking for a poetry group that she could maybe go to. And even though there was a good few around, I felt because of some of the changes in her memory, she just might not feel that. She wasn't confident about her poetry anyway. So I thought, well, and then on top of that, some of the memory challenges. So I reached out to Moira Davey in the Arts Office. And before we knew it, we had 9 people in a room writing poetry. So the first day everybody came in, we had a beautiful poet called Grace Willents who facilitated the poetry sessions. I can't do what she does, and she couldn't do what I did.
Go back to your partnership and collaboration.
That's it. And the arts and health collaboration. So she's there as a poet, thinking about her poems, reading a poem, asking people to reflect on that poem, and then guiding people through writing a poem. And then I'm there knowing, okay, I might just need to adapt that a little bit so that that person can succeed. And I've engendered people's trust already, and that's why they're in the room. So what we both brought to the group then created a little bit of magic alongside what everybody else brought to the group. So only one person who came to the group had ever written a poem before in their life, and nobody else prior to walking in the door had ever written a poem. And we wrote them together over 4 weeks. And then we got a few notions then, because we thought, well, maybe we could try and get them into a pamphlet. So then we said, right, we'll get them into a pamphlet. And then we said, well, sure, maybe we'll have to have a launch of this pamphlet. So we had an evening where all the poets came together and stood up and physically read their poems out loud in front of people, which is something from a capability perspective and from a confidence perspective, they didn't think they would have been able to do, and then they did. So creativity, the fact that we got them all together, and it allowed just that little shift of light nearly in them and a shift of confidence and hope and back to hope. That, okay, well, I have memory challenges or I have a diagnosis of dementia, but I can still do this and I'm still capable, and it's incredible. And so up they got and everybody read them, and it was an incredible evening. So I don't know, you might like a poem, would you?
Absolutely, yeah. No, you promised us a poem. You got to give us a poem.
I know, yeah. Well, I'll give you 2 poems if you like. The first poem is written by Roger, The poem is Your Small, Warm Hands Around My Neck. Your small, warm hands around my neck, awaiting to be caressed. Lying on a golden sofa, sunshine hot on her arms. Does this feel like Spain last week? She said, I love you, Grandad.
Oh, wow. That is powerful stuff. Matthew, give us a bit of reader response to that.
While I wipe a tear from my eye.
Yeah. No, God almighty.
First poem he ever wrote in his life.
Wow, it really packs a punch there.
Packs a punch. And, you know, I suppose with those poems, Grace was so wonderful in how she supported everybody, because that first week, everyone's nervous. We're all sitting around. I'm nervous. I don't know if this is going to work. We're all feeling it. And Grace was just, oh my God, she brought such calm energy to the room. And essentially, with the creation of those poems around the hands, what she got us all to think about, first of all, was think about somebody who you love. And then think about what their hands look like. And so then we just wrote the first line, a description of their hands. And then the second line was, now, what might they be doing with their hands? So they might be baking, knitting, gardening. So that was the next line. So she really took us through line by line so that it settled everybody in the room. But then when you put those 5 lines together, this is what you got, was this most incredibly moving piece of poetry, piece of art that someone had created.
Yeah. It just reminds us again that, like, with the bit of support and that little architecture, like you're talking about, even the templates for the meaning making and finding people's story and history and who they are, it's so obviously central to everybody. Who are you? Where are you from? Where'd you grow up?
Like, imagine a health system that this was normalised everywhere, how that could transform the pathway for patients' experiences within hospitals, or the lived experience with various health conditions or living with comorbidities. It would make that experience so much better, and also at a very cost-effective measure for the health system. You could bring this in. The arts are both transformative and relationship building on so many levels.
Yeah, no, absolutely. And I'm reminded of the word you used at the outset about hope, Matthew. That's something that absolutely we want to encourage. And, you know, having that vision of connection to your patients and your people and creating support for other people to make connections and the emotions you spoke about. But the hope is what we're trying to get across, Matthew, isn't it?
Absolutely. For me, it's hope and normalisation. There's too much stigma around. That's why the Dementia Understand Together campaign is so important. You know, that's their main driving point, is to try and remove the stigma in society, because that's what sets a lot of people back and holds a lot of people back and impacts on people's lives. They feel they can't go out and engage in normal everyday activities because they're embarrassed, or they feel isolated or marginalised by their disability. That's not right. It's not right. And it's up to us to change that. They can't change those constructs in society. We can do that.
Yeah, great call.
Yeah, and change is happening.
Yeah, you've given a good few examples. Things have shifted even in your own work experience.
I do have another poem. This is emotional and funny in another way, so
Okay.
maybe it's a nice way to finish it. And this is from a gentleman named David, and it's called Not Many Words Will Rhyme with White. Not many words will rhyme with white, and some of them are not polite. So they're the ones I didn't write.
Very good. Okay, well, on that note, that's a nice little one to cheer us up. I'd like to thank you all very sincerely for your input in the podcast today. Rosin Nevin, Matthew Gibb, Catherine Daly, I really appreciate your inputs and your conversations, sharing your experience. It's been so insightful. For the listeners, I'd like to thank you for listening to another episode. If you think you'd know somebody that would get value out of this discussion, please share the podcast episode with a friend or a family member you think would get something out of it. And if you want to contact us, please email on healthandwellbeing.communications@hse.ie. And thank you for listening to another episode of the HSE Talking Health and Wellbeing podcast.